want to cover with you two easy actually self-tests that you can do in the safety of your own home that'll help you understand whether or not this might be something that's causing your back pain. Again, remember, a lot of people are living with this, and so I think it's important for you to be able to take control of your health and understand whether or not you have it or not. So just to review, the first self-test is actually what's called the clinical predictor rule, which is the 4 questions that I told you earlier. So those 4 questions to review are you over the age of 50? Do you have pain with standing? Do you have pain in your lower back with walking? And does that pain go away when you sit down? If you answered yes to all 4 of those questions, research shows there's a 97% chance that you have stenosis or arthritis in your spine, and that is the type of back pain you're dealing with. Remember, the type is different than the cause. Now, the second test is more of a movement-related test. Very easy to do, and maybe a disclaimer is this movement is a test that if positive, it's because it hurts. So you can try these movements, but beware at home. You don't want to hurt yourself. I'm just going to demonstrate, and you need to be careful when you're doing this at home. So we know that there was 3 ways to make the hole smaller, as I mentioned earlier. And you go through those 3 movements. So the first movement was bending backwards. So you take your shoulders and your upper body and you bend backwards. If that hurts, that's a sign that you have a problem with the hole closing down. Hurting in the back or traveling down the leg. If you have pain down your leg when you do that as well, that's also a positive sign. Okay, the second motion is bending to the side. So if I have left-sided back pain, if I bend to the left, that closes the hole down. Again, that's another indicator there's a chance you have the hole narrowing and there's stenosis or arthritis. And the third one is when you turn your body to the right. So if I turn my arm and my shoulders to the right and that hurts my left side, again, that's another indicator. Now, the real test is actually combining all 3 of those at the same time. It's called a quadrant test. And so what we do there, if I'm testing my left side, I'm gonna lean back, I'm gonna also lean to the left, and then at the same time, I'm gonna turn to the right. Kind of looks like a backswing for a golfer. If I have pain on my left side, very strong indicator that stenosis is part of the problem. Now, I can test the right side by doing the exact same thing. I can lean back, I can lean to the right, and I can also turn to the left. Again, that closes down the right side and makes the hole smaller. If I have any back pain or sciatic pain, remember, sciatic pain is the pain that travels down the back of your leg where there's numbness, tingling, and even sometimes feeling like the leg is getting weak. Those are all symptoms that would indicate a positive quadrant test. So there's 2 really easy tests that you can do that I typically start with when I meet somebody in the clinic. And I'm always trying to meet somebody and very quickly help them understand whether or not we can help them heal naturally without medications, without injections, and without surgery. That's the name of the game if you want to return to pain-free living.